Daisy, you mentioned supervisors in that last piece of information you were sharing. And, the next question leans to that. Like, how can clinical supervisors or organizational leaders support staff healing with STS or compassion fatigue, right? So support structures matter, as we know, within any space. What are some effective, tangible ways supervisors or organizational leaders can recognize, respond to, or help mitigate compassion fatigue or secondary trauma among their teams? I'm gonna put this question in the chat here for y'all.
Man, I think this one's really important because we have to, as counseling supervisors or clinical supervisors, we have to remember that our supervisees are human, and we have to really approach them with that responsiveness and that humility to understand that just because they hold the role of a counselor or social worker, psychologist, whatever that role is, that doesn't mean that they're not human. And we have to be able to see them as that. And humans, we're all going to have those experiences that add up. And being able to foster an environment for safety and bravery, vulnerability, right? So that way we can have those dialogues without feeling the pressure of just the work, right? Or feeling the power dynamic that exists between supervisors and supervisees, right? So being able to just really, really see them as individual people. And then I think about that too, and advocating in the systems that we work in, right? So if we're working independently and we have our own practice, we might have a little bit more autonomy on what we can do with that. But if we're working in community mental health or another type of agency that has a lot of guidelines or has a lot of financial means that has to happen with the work, sometimes that advocating can be a little bit more difficult, and we have to navigate around that to be able to meet our supervisees' needs.
Yeah, building a little bit on what you just said, Daisy, I think it's all of that. And I think, for me, it's a lot about validating, right, their lived experience as well, right? Because, I think our young clinicians of color coming up in this field, they suffer probably much earlier than I think what some of our experiences were of that imposter syndrome, right? Because we're learning so much about psychopathology, right? And the diagnostic criteria, right? And all this dang mental health jargon that, is just a part of our field. And so, like, they learn very early because that's where the language is going. They start pathologizing themselves, so they really start feeling like, what am I doing? Maybe I'm not equipped to do this. And so we really have to, like, I know, and what I work with my supervisees is like, I'm validating their lived experience. I'm validating and kind of restructuring, right? Like their ideas of like what they feel like they're doing in that moment, and just being like, hey, just remove the pathology for a little bit. Like, yes, we know we want to name it to tame it, but what if you didn't have to do that right now? Because a lot of that is built within some of that structural, right? Structural harm that exists. And so it's helping them to really understand and garner their own awareness, and promoting some of that identity affirmation, because like what they do matters, right? And what we do as clinicians of color matters. And so I think it's incorporating, cultural humility, that intersectional awareness, and bringing that into like our work and promoting like reflective practices, and not just, right, like case management is, and I know that's what we spend time doing, because case management is one thing, but like feedback informed and kind of those reflective practices that just give them time to, and an opportunity to just be present with whatever their experience is with it, and creating that space, right? So like, I love what I've created. I surrounded myself by clinicians of color, so when we talk about issues, we don't have any other intersecting cultures or races, right? Like, it's all of us as Black and brown clinicians talking about like the real experiences that we have. And it matters, right? It matters, and it changes our language, and it changes the way that we get to experience it, right? So, creating those spaces, and the training, right? And I think training on one end, right, we know it's cost prohibitive in our profession, but what steps and what ways can we like pool resources, right? Which I think is a work of just like doing some of our own training. Like, what have we learned and what wisdom can we pass on to these young up and coming clinicians? Because, we've been experiencing for a little bit, and our own experiences model those possibilities. And so, spend a lot of time making those spaces and really helping them understand, like, again, we do a lot of work for the people, but we are not the people's therapists. And it's just not possible for us to be, especially, right? Like knowing that right now, I'll say being a clinician of color, it's very much trending too, right? And I think that kind of speaks to what you were talking about, Dr. J, with that success kind of remorse. And I know I'm sitting with my clinicians and helping them be like no, be unapologetic in being a clinician of color right now. Like, your community is looking for you and they want you, and you're going to be booked and busy, and that's okay. And stay booked and busy, but take care of you, because in order to continue to do the work, you got to take care of you and create that fertile playground, if you will, to keep those possibilities going for our community and for yourself, right? So I'm gonna stop because I know I'll keep going.
Rossina, I love that you brought that up, especially the identity work. And what comes to mind for me is being able to teach clinicians not to have this like pathway in their mind that they need to have inner retribution towards themselves when they make a mistake, when they don't show up as who they want to be, or that compassion fatigue is really like that elephant on their chest. I think, like, coming from someone who is newer into the field, graduated 2021, I think what I did not get was you're able to like just be. And I don't have to go to this place of, oh, how can I like internalize and attack my character and myself because I'm experiencing compassion fatigue, because I'm feeling exhaustion, because I'm feeling that heaviness of, I know I'm called to do this work. And man, doing this work can be exhausting, And so I think being able to training of knowing who you are and not attaching it to the exhaustion that you feel, as a clinician. And like, if I could send a message to any baby therapist, it's about like continuing the journey without feeling like I need to betray myself to do it. And through that betrayal, I lose myself and my purpose. You can go that pathway and still have that integration in yourself to know, like, I know who I am, I know why I'm in this work, and my tiny paper cuts, they're there with me for a reason, and I don't have to get to this point where the cost of me being a therapist is me feeling in disalignment with myself.
I love all of that. I'm gonna pivot us just because of our time, and I know Dr. J looked like she was gonna come in and give some more heat for that one, but we're gonna pause on that one, Dr. J, just so we can get to this next question, question number 4, and this one is actually a really great one for this group and for someone who cares for y'all on an individual basis and our relations and stuff. This one is all about how can therapists set boundaries that are both ethical and protective of their well-being.
Not intentionally, but I'll go ahead and continue because I got really excited with this one too, right? Because I think you also led into it a little bit, Dominique, when you were talking, right? Like that self-compassion. And I think in self-compassion, there's also like helping, right? Like I think a lot of our work as clinicians is spending time like really understanding this boundaries, and that boundaries are okay, this self-compassion when we have to uphold those boundaries, because our little itty bitty committees, I won't say my normal word, but the little itty bitty committees of our mind really like to like hold us hostage, right? And it doesn't really give us permission to really fully embody like what I also think is a part of it, a radical self-preservation. right? Because we are navigating these dual realities of not just like our clinical self, but also our cultural self. And we exist in this like at both times. And so, like, I think that's really like a very important part to like name and frame these limits very early in our work and right model and teach right this kind of up and coming that like this is what I can offer and this is what I need to be able to stay grounded and effective in this work. Because like when we don't do that, that's a surefire path to compassion fatigue, burnout, and secondary traumatic stress, right? Because we're not creating this awareness of like this moment of like the client's experiences, our exposure to our clients' experiences, and our supports and ability to kind of process it all, right? Like there's this one little special spot in that kind of model of like how we be able to do that. And it's by modeling, it's shoring up their clinical skills and our own clinical skills by the issues that are most relevant and pressing within our community, especially as we like as ourselves are doing this work, making sure that we put those buffers in to not overextend ourselves and recognizing that some of these frameworks don't fully acknowledge, and I think we've all been saying it, but they don't fully acknowledge like our own cultural norms around like how we show up collectively. And it does take some work to reconcile like some of those differences in like what our cultural values and nuances are, and reconciling those even with the professional ethics that we have to uphold. There are some conflicts there, right? And so, I think like us here, we all, I'm sure in some form or fashion, are doing that work to show like what does it look like to set those boundaries, what it looks like in the ethical practice of like our profession. But also we also said that penalizing, right? Making sure that these young clinicians are learning not to penalize, and hold it against themselves as like they can't be available for, or that they're not committed to this profession, but that they actually are. And it's that demonstration of radical self-preservation, right? Because if we don't have that, we won't have capacity to be present in this field at all.
That's very good. I think about the beginning counseling class that I just taught this semester on ethics, and talking to them and saying, you must have self-care. You must take care of yourself. You must find a way to depressurize, because this is a lot. And I believe as I grow and mature in this field, what I thought was good for me in the beginning has changed. Owning your own private practice, that changes what those boundaries look like. You not only have to set boundaries with your clients, you have to set boundaries with those you supervise as well, so that they not pulling on you in a place where you can't be there for them on a consistent basis. So I'm learning to say, okay, this is what I can do for you.
Yeah.
This is what I can't do for you. This here, you need to be fed somewhere else. My table is going to feed you here. You're going to get this from me consistently. But this piece here, I need you to seek other support. And teaching us that we can't get everything from one person. We need different people providing support for us. I had a mentor who went through a list. She says, you have 24 hours in a day. You are going to school, you doing this. When I was in a doctor program and I was battling cancer, she said, you can't have no more than these many clients. You can't do no more than this. And so, although my schedule has shifted a little bit and I could do a little bit more than when I was in school, but I try to stick to that guideline, because we will providing service and having empathy for our community. I can have 30 clients a day, because that's what they looking for. And if you're good at because we're good at what we do, people keep coming back and they don't want to leave. Clients don't want to leave. They don't. It's like, okay, we've met everything on your list. What else do you want to do? Well, nothing. But no, you need to go out there and see and put into play everything that we've worked. And you can always come back for a touch up. You can always come back for a refresher. No, I just want to stay with you ever. So it can be a lot trying to be there for your community and those you supervise.
Yeah, I think that's a very good point about boundaries with our clients too. And sometimes counseling can feel like a 24-hour like role that we play, and being able to have our clients understand like this is when I'm able to support you, and this is, like you said, this is when you can use those other supports that we have in place that we've identified for you, so that way the clinician themselves doesn't feel so heavy with having to have this on their mind all the time, right? Being able to set a boundary and transition from workspace to home space, and whatever that looks like, it's going to be really important. I always um really have supervisees understand like what does that transition look like when you leave this building? What happens for you? Like, how do you transition into your next role, whether that role is a student, if that's a parent, if that's, a caregiver, or whatever that is, like what does that transition look like? Because you can't hold this all the time. It'll get too heavy, and it'll start to impact you in other ways that you don't realize. And don't be afraid to not answer an email. Sometimes like sometimes emails, in the role that I have as a manager, as a supervisor, as a counselor, like the emails just keep coming. They just keep coming. And sometimes, I tell them, I was like, is this an especially from parents in youth work, right? So parents are constantly emailing about this and that. And, I work with my supervisees to determine, like, is this an emergency, or is this something they just want you to know, right? You don't have to feel pressure to email them back on your day off or anything like that, right? We've been able to put supports in place, and sometimes, they just want you to know this information. They don't necessarily want you to do anything with it. And being able to not answer that email and have appropriate boundaries on when you answer emails, right? I'll get back to you within 48 to 72 hours, or whatever that looks like for them in that position. But being able to have that transition in between those roles is going to be really important for mitigating compassion fatigue as well.
Yeah, and I feel like one thing that comes to mind in order to access this mindset that I can set boundaries, I think there has to be an addressing of worthiness, because I think in this field there is this pressure to subscribe to always being on and always being a doer and getting things done, handling it at urgent timing. Like there is no slow pace. Um, and I think when I think of boundaries, I think people may feel I can't set a boundary because the cost of me setting a boundary will impact this person or this patient or this coworker in this way. But my favorite question to ask as a therapist is, what's the cost for you? What's the cost for you? Because at the end of the day, the person who is most responsible for you is yourself. And so if you are not able to feel that worthiness of, I deserve to have peace and joy and balance in my practice a as a clinician, but also in your personal life, like that accessing of the boundaries is going to be limited because you're not able to let yourself all the way have it and all the way go there and stand firm on those boundaries. So I think the teaching of inner worthiness and feeling like this is something that I can access and that I get to create and it's mine to hold, I think that that is a really powerful skill for therapists to understand.
I love that, Dom. Y'all all dropping some gems today, and just the different thoughts. Obviously, being a fly on the wall here and taking in the different thoughts here, they're so aligned, right? They're different because y'all going through your own experience with it, right? But it almost all falls in the same alignment. So we're at the end of our segment. We have one more question here. We have a few minutes. So be mindful of how much you're going into it. I want to hear it all. I might have to like set up another segment for 2 hours just for y'all. But in this case, We're getting towards the end of this beautiful segment. The last question here is, what does a trauma-informed work environment look like for providers? Right? I'm gonna put it in the chat. Whoever wants to go first, don't hesitate. We got a few minutes here. Let's go.
So I think I'm just gonna say one or two sentences about how do we get systems, the systems that we all work under, to be trauma informed with their staff, and not only check it, I mean, they're just checking it off a box, but being really intentional on what that looks like. What I find is that's part of the difficulty is the systems that we work in, right? We all know what we need and want. We've been able to express it today. Now, how do we get the systems that we engage with and that pay our, help us pay our bills to do some of that? Not only, they do it for their clients, but a lot of times the expectations don't support a trauma-informed environment. And I think that's the challenge that I'm thinking of, is like, how do we evolve to a place where our systems can recognize that and hold it as important as they hold the financials.
Yeah, building off of what you just said, Daisy, for sure. I think, when we talk about trauma informed, like, it's not just a niche word. We're throwing it out there an awful lot, but I think it really embodies like psychological safety, cultural safety. It's integrating and centering wellness like at the forefront, and not just like having it being an afterthought, right? And it's a space that also I think is, which I don't know that many environments really are doing it, but I think it also embodies like a place of like reflective support and communal healing practices, as well as like promoting flexibility, right? Flexibility that give not just like identities a place to be, but that they're protected, right? And it does exist in some of that anti-oppressive work that we're talking about. But it also is a culture that holds like accountability, because it's not just about like saying we're doing the work, but like holding entities and structures like accountable for times and spaces where they're not, and where they are creating repair, or not creating repair, but they're creating more harm. And then like, what are we doing? Like, what narratives are we creating around the harm, and how are we wrapping around that to also then create systems and structures of repair, right? And I think that's really what trauma informed is. It's looking at the harm that's happening, it's holding accountability, but also like, what are we doing to repair and atone? Because we can't just leave like this space of trauma and just like talking about these structures, but like there's work to do to fix it too. And so I think trauma informed does all of that.
Thank you, ladies. That's some good information. I want to piggyback on what Dominique said in the very beginning, having little cuts, right? Little trauma cuts all over the place. So having a first aid kit, and what is in that first aid kit, and what's in your first aid kit might not be what's in my first aid kit, but the first aid kit will be relevant for the demographics and for the people that I'm providing services for. What I put it in the beginning might shift, because a new group of people might come in, a new group of interns might come in, and we're not trained the way I was trained, and they come in with all this hurt and this pain and feeling all this stuff, but they want to work with clients. So how can I make sure that they're healthy and whole to the best of my ability, so the clients that are coming into my practice won't be re-injured, right? So making sure that I work with other professionals and provide training for my staff, and training for me, so that I can constantly be made aware of what needs to go in my first aid kit.
I love the first aid kit idea, and it reminds me of compound interest. So it's like what you put in a preventative but responsive manner in an environment for clinicians, having that be consistent, and having that first aid kit where someone is developing and evolving that over time, that compound interest of taking care of that to me, secures that environment for it to be trauma informed. So I'm going to take that for myself.
I love all of this, y'all. For me, I've never sat in a room by myself with 4 therapists, so this is pretty unique for me. And it didn't feel overwhelming either. It felt like really comfortable, and that's to y'all energy. I love this conversation. I feel like there were so many layers to different things that y'all said, the relation pieces, the alignments, the knowledge shared and wisdom shared, which is so beautiful to see as well, from different perspectives and point of views. I want to end this segment with maybe a 2-word. I usually do a 1-word gratitude in every space that I do. I want to do more of a 2-word, what did you learn? Using 2 words that represents what you learned in this session. And for me, my 2 words are inspired. I'm inspired. That's something that I just felt through this whole experience. And the second one is information. Those are my 2 words: inspired, information. And then I'm going to pass it to Dr. J for your 2 words. And Dr. J, if you can pass it to the next person, and we'll wrap up our segment.
My 2 words are grateful and powerful. I'm gonna pass it to Dominique.
My 2 words are alignment and blessed. I pass it to Rossina.
Yes, you took one of my words, Dominique. I was going to also say alignment. So we'll just say communal healing, right, as one word. And definitely there's a gratitude, I'll say too. I got something stronger, but I'm gonna leave it there. And Daisy.
Yeah, and Rossina, you were reading what I was thinking, because my 2 words, one of them is community, just within this space, and the other one is fulfilled.
All right. I love that. Thank you, audience, for being here and checking out this segment. Please like, subscribe, and comment so you can continue to get these gems. And the beauty of this segment is beyond just speaking on this topic. It is bringing Black and Brown therapists to the space so people can meet them. So thank you, ladies, for everything you do, for the people you help it heal. It is Wednesday, so you know what you need to do. Take that 1 minute for yourself. We will put this 1 minute at the end of this segment. And remember, that 1 minute is for you. If you want to take that minute to love yourself, remind yourself about all the people who helped you, whatever it is in that minute, it belongs to you. It starts with 1 minute, y'all. And it can turn into an hour, it can turn into a week, but let's start with 1 minute. So on this Mental Health Minute, take care of yourselves, because you are a star player, and you know what my last words for you are. Who's helping you heal, y'all? Peace.